Good morning, guys. My name is Rachel, and I have Ehlers-Danlos syndrome. That causes me to need to do a lot of medical travel. And that's what I would like to talk about in today's video is why do EDS and HSD patients often have to travel very far to get the right medical treatment that they need. I live in Utah right now, and during this year, I've spent over half of this entire year on the East Coast to either be seeing doctors that I need to see, having surgeries, recovering from surgeries. I know that sounds crazy to most people, and a lot of people that I tell about where my doctors are or where I'm having surgery, they're like, are you sure there's not a specialist at the University of Utah or in North Carolina where my family lives, at Duke, that can help you? People will say, there's so many great doctors here, there has to be someone that could help you with whatever's going on. And the reality of it is that there isn't. And EDS patients are often very well connected. We have to put in a lot of research to find the right doctors to see, and often doctors that are local to us send us elsewhere because they aren't able to give us the right care. It's kind of tough to explain that to people, why these great hospitals don't have resources for us, but that's the truth. Honestly, it's scary, especially because not everyone has the means to do medical travel, not everyone can afford it, not everyone's insurance covers it, and not everyone has somebody to go with them to help them because they're so sick. And it's a huge problem. I know that it's a true blessing that I'm able to do the medical travel that I need to do. I asked you guys that have EDS or HSD, hypermobility spectrum disorder, which types of doctors or specialists that you've had to travel more than 2 hours to go see. It's quite a long list. I'll just go through it. Cardiologist, colorectal surgeon, complex care doctor, dysautonomia and POTS specialists, EDS specialists, GI specialists, geneticists, intestinal failure specialist, mast cell or allergy specialists, motility specialists, neuroradiologists, neurogastroimmunology, haven't heard of that one, neurologists, neurosurgeons, ophthalmologists, orthopedic surgeons, pain management doctors, physical therapists, plastic surgeons, radiologists, rheumatologists, TMJ specialists, transplant surgeons, urogynecologists, and vascular surgeons. So that's a long list. I think something that a lot of people don't know about EDS is that it affects everyone very differently. And so some people have a lot of neurological issues, which is the most severe area that I've dealt with personally, but others have very severe issues with their joints or with their GI system or their heart or their mast cells or dysautonomia, whatever it may be. And a lot of us have like a combination of these issues or even all of these issues. And so it's a really difficult condition to address and to treat. And there are not a lot of doctors that specialize in it right now. If someone with EDS tells you that they are traveling to go see a doctor, 99 times out of 100, they have done their research and they know for a fact that there isn't a doctor locally to them that can help them with this. We don't want to do medical travel. We don't want to travel across the country or even across the world to get medical care while we are really sick. But that's what a lot of us have to do, and it's hard. So I really, really hope that more doctors will become aware of EDS and specialize in EDS and all of its complex comorbid conditions so that we will be able to get better help in the future. Finding good EDS doctors is important for us because a lot of times your average doctor just doesn't know enough to help you, and actually may do harm to you if they don't know how to properly care for you in, you know, surgery or medications or whatever, physical therapy, whatever it might be. I personally have in the last year traveled to 5 times to New York City, 7 times to Maryland, 4 times to Virginia, countless times to North Carolina, and 1 time to Rhode Island for EDS care. And it's really hard when you're really sick to do that. And sometimes people ask me, oh, you went to DC, like what did you do? What museums did you go see? Or, you know, what fun things did you go do in New York while you were there? And most of the time our answer is we didn't do anything. The travel was too taxing, and a lot of times, you know, we're too sick to go out and do touristy and fun travel things while we are there for our medical treatment. So for all you guys that have to do a lot of medical travel, I know how hard that is. I really wish you all of the best, and I hope that this video gives you a better idea as to why EDS patients often have to travel so far to receive the right medical care that they need. And if you have any family or friends that are struggling to understand that, feel free to share this video with them. And if you'd like to follow along on my journey with EDS, then you can click subscribe, and I will look forward to seeing you next time. Bye guys.